Good morning, everybody, or good afternoon, good evening, depending on where you are. We're going to give it just a few more seconds and then we'll get started. All right. So welcome. Thank you so much for joining us from all around the world. I hope you're all well. My name is Natalie Drazen, and I am the North America Director and United Nations Representative for the FIA Foundation, as well as the advisor to the Health and Safety Hub hosted at the ITF with support from the WHO. I'm very thrilled and honored to be moderating because today we are celebrating. We're celebrating your work to save lives. What you do is not easy. You probably don't really get thanked when someone makes it home alive. But today we're going to share a number that I hope will continue to drive your work. Thanks to Johns Hopkins University, for the first time, we will share an estimate of lives saved and serious injuries avoided by governments, development banks, and road operators worldwide implementing safer road projects, informed by the IRAP methodology and tools. IRAP has been at the forefront of tackling our epidemic on wheels, which continues to be the leading cause of death for young people. Every single day, thousands of people are killed or suffer horrific injuries. Crashes can plunge families into poverty for generations to come. Serious injuries can change the entire fabric of families and communities. This is not sustainable, but it is preventable. The World Health Organization's new global status report on road safety that was released in December showed that globally, road deaths and injuries have declined for the first time on record. What helped lead to this decline? Improved road safety standards. And who was behind that? Well, so many of you using IRAP methodology and tools. IRAP partnerships span over 125 countries, including 1.8 million kilometers of risk mapping and 1.8 million kilometers of star ratings of roads, designs, and schools. IRAP partnerships have influenced the safety of a whopping $100 billion of road investment. How many lives have been saved and injuries have been prevented as a result? We're just about to find out. So feel free to do a tiny drum roll at your desk if you like. Go ahead. World-leading research out of Johns Hopkins University and published in PLOS One estimates that safer road projects implemented by governments, development banks, and road operators worldwide, informed by the IRAP methodology and tools, have saved 700,000 deaths and serious injuries by the end of 2024. And what's more is that by 2044, almost 3.2 million fatalities and serious injuries will have been prevented. 3.2 million. Feel free to check out the paper, which is called Statistical Estimation of Fatal and Serious Injuries Saved by IRAP Protocols in 74 Countries. It's a bit of a mouthful. It estimates that the likely impact of road improvements in 1,039 infrastructure projects where the IRAP methodology and tools were used. This number is really impressive. And frankly, I've personally never been so proud to be a Hopkins alum or to work for the FIA Foundation, which is a leading donor to IRAP. So today we're going to hear more from IRAP stakeholders. We have a truly impressive lineup. We'll start with Etienne Krug, who is the Director of Social Determinants of Health from the World Health Organization. And you'll also hear from IRAP's founding and current chairman, John Dawson and Miguel Nadal, and of course, the FIA Foundation's very own Saul Billingsley. We'll also hear a personal story and youth perspective from Dr. Reem El-Sherbini, and we'll hear from the co-authors of the study, Professor Abdul Bashani and Professor Qingfeng Li and James Bradford. Finally, we'll hear from several important IRAP partners sharing case studies from regions all over the world. And of course, the event would not be complete without some words from my friend and IRAP CEO, Rob McInerney. Today's shared impact is truly the work of IRAP's partners, supported in the background by the charity's tools and resources. But again, this is about you, all of you on this webinar. IRAP is always looking to improve its tools and methodologies. So if you have any questions, feel free to add them in the chat for the end of the session. And also you can designate which speaker you'd like to answer them. You could put them on the spot. So let's get started. I'd like to begin with Etienne Krug, who's the Director of the Social Determinants of Health for the World Health Organization. He has provided us with a very special video message.
Good day, colleagues, and welcome to this webinar on road infrastructure and speeding. 20 years ago, the World Health Organization and the World Bank launched the first ever world report on road traffic injury prevention and established the UN Road Safety Collaboration. The report, already then, called for strengthening efforts to improve infrastructure and address speeding. IRAP became a strong partner in these efforts from day one. The recent Global Status Report on Road Safety 2023 has shown that during the first decade of action, 2011-2020, some progress was made. A reduction in 5% in road traffic deaths in absolute numbers and 16% when this is put into comparison to the population increase into a rate. The numbers being released today, compiling fatal and non-fatal injuries, are an important contribution to this global improvement. Congratulations to all IRAP partners for this momentous achievement. But clearly, we have to do more. Road traffic crashes still kill 1.19 million people annually and remain the leading cause of death for youth. More than half of these deaths are among pedestrians, cyclists, and motorcyclists. The global plan for the current decade of action provides a vital roadmap for governments and stakeholders as they develop and implement national and local action plans to halve global road traffic deaths and injuries by 2030. It outlines the what to do, how to do, and who to do it. Safe road infrastructure and addressing speeding are key focus in this global plan, which is also accompanied by 12 global road safety performance targets. Targets 3 and 4 are about ensuring all new roads are built to a 3-star or better standard for all road users. And target 4, that more than 75% of travel on existing roads is on the equivalent of 3-star or better roads for all who use them by 2030. To achieve that, we need to redouble our efforts and build even stronger political commitment. In February, world leaders will gather for the 4th Global Ministerial Conference on Road Safety in Marrakesh, which will be an opportunity to do exactly that, build political momentum. I hope to see many of you there. In the meanwhile, it is important to recognize and celebrate success. Congratulations again, and thank you for all you're doing. Please keep up the great work.
Thank you so much, Etienne, and to the WHO for, of course, everything that you have done to advocate for this cause and save lives on roads. Now, as you heard from Etienne, IRAP has played a critical part in striving for those UN Sustainable Development Goals. I'd now like to welcome someone who's been there since the start of IRAP, its founding chairman, John Dawson, who will tell us more about where it all began. John, the floor is yours. It's wonderful to see you.
Natalie, it's lovely to see you and see you all. It's really a truly proud milestone for us all. Literally thousands and thousands of people have been involved in getting to this point. It was 25 years ago that the idea that you could measure the safety of roads, like we had just achieved with cars with the NCAP program, was born, and it spread incredibly rapidly once we had the first R&D completed. From the start, it was conceived as a partnership between road authorities, and civil society. And in the early days, the technical side absolutely dominated everything. It was only around about 2004, 2005 that the rollout, as it became more and more successful, spreading from at first 4 countries, then within a couple of years to 20, and then as it is today, way over 100, that the sheer management challenge was unveiled, and for that, Rob and Shona Holroyd, the CFO, have to take very great credit, because managing a multinational program like this with all the complexities of almost a big oil company it is quite an astonishing achievement for a relatively a small charity. None of this could have been achieved without grit, real grit, from the leadership team, from the long-term support of the FIA Foundation. It is an extraordinary, wonderful thing that the FIA Foundation has been on board right from the very early days and maintained its support. And of course, the development banks have all played a fantastic role, in particular, right from the start, the Global Road Safety Facility. And so it has been an amazing journey to measure and manage the safety of the roads world, the world's roads. I'd only close in sort of saying one thing that I remember well was when the support was first voted by the FIA Foundation. One of the world's leading economists who was sitting on the board said that he was giving his support because the idea that you could build an economic model just by driving through a road network was one of the most astonishing things he'd ever heard. And we delivered that early promise, and the thousands and thousands of partners and individuals who are really gifted have all achieved what we celebrate today. So Natalie, it's a really great pleasure. I'm really honored to be sitting here today and just reflect on what we've all done. And really, it's the consistency and the grit to carry on and on against this terrible challenge that Etienne has given us, the 1.19 million deaths. That's still a terrible number, and we must keep going.
John, one thing I love about you is how humble you always are and how kind you are to recognize all of the stakeholders behind IRAP's success. But I also want to take a moment just to thank you for the lasting legacy that you have created. And now I'd like to welcome the person carrying the torch, IRAP's current board chairman, Miguel Nadal, who will join us as we look ahead to IRAP's partnerships for 2030 and their impact. Miguel, wonderful to see you. Thank you for being here.
Thanks, Natalie. As chair of IRAP, I'm most happy to be celebrating this really wonderful achievement with all of you. As John was saying, IRAP is in fact a relatively young organization. It started its activities in the early 2000s, and actually it was established as a charity only in 2011. But I think that its success in this short period of time is extremely remarkable. And in my view, there are two explanations, two factors that explain this huge success in such a short period of time. First, the technicalities, to put it somehow. I mean, the fact that IRAP tools are based on state-of-the-art knowledge and are designed to have real impact, as the one that we are celebrating today. I think this is a key feature of IRAP. IRAP tools are easy to understand, are easy to implement, and are easy to communicate. And this makes them extremely attractive to all those partners that have to use them. And IRAP tools are constantly being updated and improved day by day. The second factor that, in my view, explains IRAP's success, as John also was saying, is the fact that IRAP was, from the start, conceived as a catalytic organization, as a catalyst. The ultimate goal of IRAP is to help mobilize all the relevant stakeholders in the same direction, namely to improve the standards of world roads and to save lives. So what we are celebrating today is, in fact, a shared success, and I want to stress this very much. John has referred to this, but this is very important. It's a success shared by governments, by development banks, by many other multilateral institutions, many of them under the UN umbrella, by the FIA clubs. I want to stress the role that the FIA and its clubs have played in the development of IRAP, and by the NGO communities. Without their commitment and contribution, IRAP's success would not have been possible. So many thanks to all our partners. And last but not least, I want to have a special acknowledgement, first of all, for my fellow trustees of the charity. And here I want to remember some of them who are not with us anymore. And I'm thinking of Gary Liddell or Peter Kissinger, who played a decisive role in the consolidation of IRAP. I want also to acknowledge all the hardworking and passionate IRAP team members, led by Rob. Rob, we all know it's a force of nature, and I think it embodies perfectly the spirit and the ambitions of IRAP. And finally, and John has stressed this also, the key role that the FIA Foundation has played in all this. Without the unwavering support of the foundation, IRAP would not exist today. IRAP would not have been possible. And I think that without IRAP, also modestly, the foundation would be a little bit different. So I know that Sol is with us today. So thank you very much for the foundation's vision and generosity. Of course, we need to keep working. We count on everyone. We want to scale up all the results that we are having, because the challenges ahead are huge. So thank you very much to you all. Pass the word to you back, Natalie. Thank you.
Thank you so much, Miguel, for your kind words and your leadership, and also for highlighting those key features of IRAP. I can actually attest to the fact that the tools are easy to use. I wish I had an engineering degree. I don't have one, but I have even successfully used the Star Ratings for Schools app, for example. So there's a lot to be said for that. Now, as Miguel mentioned, one of the organizations behind making IRAP's methodology, tools, and training free of charge, of course, is the FIA Foundation. And we are very proud to be the long-term and major donor of IRAP. Next, we'll hear from our Executive Director, Saul Billingsley.
Hello, I'm Saul Billingsley, Executive Director of the FIA Foundation. I'm delighted to join this webinar, which is publishing important new analysis on the work of IRAP, prepared by Johns Hopkins University. For the FIA Foundation, which has been the leading donor for IRAP over the past 2 decades, we see the analysis that you're going to hear about today as a huge vindication of the work of IRAP. When IRAP was established, it was clear that there was a need for more transparency, accountability, and collaboration to make roads safer. Focusing on safe infrastructure design, providing star ratings, providing measurement tools, providing design tools, providing training to thousands of people, IRAP has really transformed the way that safe infrastructure is dealt with around the world. But the key to IRAP's success has always been how many people it can save on the roads. How many lives can we save? How many deaths can we prevent? How many serious injuries, life-changing injuries, can we prevent? That's the real measure of IRAP's success and achievement, and for us as a foundation, of the investment that we put into the program. So the research that you're going to see today, as I say, vindicates this approach. It shows that IRAP is working, and it shows us that we must redouble our efforts. As we approach the Marrakesh Ministerial Conference, as we approach the last 5 years of the Decade of Action and the Sustainable Development Goals, we really need to see the work that IRAP is doing being multiplied tenfold across the world. We need to achieve the targets that IRAP has set itself for reducing high-risk roads. We need to see more governments understanding the safe system and taking action on preventable road traffic deaths and injuries. The research that's being published today shows that this can be achieved. Now we all need to make sure that we save many, many more lives and prevent many more serious injuries on the world's roads. Hello, I'm Saul Billingsley.
Thank you so much, Saul. It's truly an honor to work for you and, of course, for the FIA Foundation, too. Our next guest brings a critical personal perspective. It's so important because we're not just talking about statistics here, right? We're talking about individuals and their stories. Global Youth Coalition on Road Safety, SDG champion on health, Dr. Reem El-Sherbini is turning the tide against road traffic crashes, which are the leading killer of youth globally. Reem, the floor is yours. Thank you for joining us.
Thank you so much. So I'm here to share my personal story about road crash. So in my last year of training at the hospital at medical school, I experienced an incident that changed my life. Back in 2020, I ordered a car service. It was 7 p.m. when we were on a bridge, and suddenly a car appeared from the opposite direction, driving recklessly in reverse with excessive speed, and propelled onto a bump on the poorly maintained bridge. Then it fell on the car I was inside. So our car stopped suddenly, and the force unleashed like a chain reaction, causing the car behind us to collide with ours too. In the aftermath of the tragic crash, 2 lives were lost, the driver with me and the individual responsible for the collision, plus property damage to 3 vehicles, plus 4 families had to continue their lives with many, many unseen struggles. I had a facial plastic surgery, leaving a scar on my forehead, and additionally, I required 2 operations, one to place plates and screws in my right arm and another to stabilize my pelvis. And for 5 months, I relied on a wheelchair, and it took like a further few months of physiotherapy and leaning on crutches to regain my full range of movement. It was a journey that spanned 6 to 7 months, filled with physical and emotional challenges, of course. And I remember going to university for 2 exams in an ambulance car and a wheelchair because I was prohibited from sitting in a car. And we tried to ask the university to let me take the exam on the ground floor, but it was almost impossible. So the ambulance man, with the help of my mom and sister, had to hold me with the wheelchair on the stairs to reach the 3rd floor. And it was only 1 year after this incident that I realized that I needed some psychological support because I was so nervous whenever I was on a bridge, and I felt so anxious when someone asked me about my facial scar, because yes, there are long-term effects that remain forever. And like many other, I too believed that my responsible driving habits would protect me from such crashes. But the reality is that crashes can happen to anyone at any time and regardless of their driving behavior, and no one is immune to the consequences of reckless driving and bad infrastructure. This is not only my story, this is the story of 11 million young people who have to endure long-term injuries due to road crashes. And when I worked as a general practitioner in the emergency department, I witnessed a huge amount of road crash victims, especially young people, whom I remember very well. For example, a 7-year-old girl who had many operations. She was just walking out of a swimming lesson to get to her car where her mom was waiting for her, and she got hit by a motorcycle just 2 meters away from the car. This made me want to advocate for its safety and want to specialize in pediatrics. And as a young resident doctor, I call on decision makers to give healthcare workers a role in shaping road safety policies to enhance the post-crash care. And thank you everyone for inviting me to speak at this event and for listening to me.
Reem, thank you so much for joining us. And I am so very sorry that this happened to you. And I want to thank you for your courage in sharing your story and your dedication to ensuring that no one else has the same story to tell. You are so inspiring, particularly in the way you treat other victims. You're welcome. It's true, like yourself, right? With so much empathy and resolve. So thank you, Reem. Now, one critical component in ensuring that these stories are not repeated is quantifying them. And today we are spotlighting groundbreaking research that does exactly that by Johns Hopkins University, the #1 public health university in the world. The International Injury Research Unit has been a very long time leader in injury prevention. So I'd like to extend a very warm thank you and welcome to Professor Abdul Bashani, Director of the International Injury Research Unit, and Professor Qingfeng Li, the lead author as well on the research to unpack the numbers of this important study.
Thank you, Natalie, and really an honor to be here with everyone to look at these numbers and really for the first time show the impact that the work you all are doing is having on what actually matters, that is lives saved and serious injuries averted. So if we can go to the next slides. Yeah. So this slide is titled The Reality, but really this is the story, right? We all use roads. Each and every one of us uses roads. Children use roads to get to school. We use roads to get to work. We use roads to run errands. But for a long time, we've just not paid attention to how these roads are designed to ensure our safety. And with the introduction of IRAP methodologies and IRAP tools, there was an opportunity to assess these roads and make them safer for everyone. And thanks to the work that everyone on this webinar and whoever has been involved has been doing. We know that safer infrastructure plays a very key role in the safe systems approach, and that we need to design our infrastructure so that we're eliminating or reducing risks for all road users, that we can enhance accessibility, including for people with disabilities, to prevent further risks to them, as well as facilitate, transfers from one transport mode to another. We all talk about modal shifts. We all talk about roads for everyone. So we really need to pay attention to each and every mode of transport and make sure that our systems are designed to accommodate that and accommodate it safely. So we're really pleased to be a very small part of this story. Clearly, we do need to show impact, and hopefully the numbers that we're presenting today will be used to generate more momentum and more action on the ground. As we've already heard, the IRAP partnership extends to more than 125 countries, with 3.6 million kilometers of roads have been assessed, and IRAP has influenced over $100 billion of road investment. But we know more can be done and more should be done, and therefore the objective for this study was really to understand the numbers behind the story. I know we titled this webinar saying the story behind the numbers, but it's really the numbers behind the stories that we're hearing. The story that, for example, Dr. Rim just shared, and putting some objectivity behind it and making sure country governments, leaders, politicians, etc., understand that these methodologies are having an impact, and that if they do implement them, that they will see tangible results. So we looked at the global coverage. So our study was based on over 400,000 kilometers of assessed roads from 1,039 projects in 74 countries. We looked retrospectively since 2016, and then prospectively projected lives and serious injuries saved over the lifetime of these countermeasures. And with that, I'm going to hand it over to my colleague, Dr. Qingfeng Li, to really talk about the numbers, the methodology, and highlight some of those details.
Yeah, sure. Thanks, Abdul. Can we go to the next slide? Yeah, sure. This flowchart shows the protocol for IRAP. So as you can see on the left, they first inspect the road, survey the road, collect information before and then pull that information into their software to do the star rating and many other reporting. And based on those assessments, they recommend specific intervention countermeasure to a stakeholder in the city, in the country, and then they implement that together with the stakeholders. After this, actually, they resurvey the road. They update their assessments. Then based on those pre and post, we do the estimation. Next one, please. And then here is our methodology. So as I mentioned, IRAP protocol specified before and after study design. Before the implementation, they inspect the road and code the data and rate the safety, and particularly for each type of road user. And then that's the assessment is summarized into FSI. And then based on that, they recommend network-wide countermeasure. After that, they update the survey, and then for, as you may know, they have a global coverage, and data collection are pretty different on different sites, different project. And then we did the estimate for some of the project, and then we apply the estimates to country and project specific data site calibrated through the software. Next one. So this map shows the global coverage of IRAP, and then particularly those projects. And used in this study, you can see IRAP really have a global coverage that cover North America, Latin America, Asia, Africa, and Europe, and many countries around the world. And then that's also the color shows different level of life and serious injury saved. Next one, please. Here are the key findings in addition to the 700,000 number you already heard. So actually, currently, IRAP protocol are saving about 160,000 per year. As you can see, their saving has been actually been accelerating over time, right? Currently saving more than the average number, and then going forward, and then they may save even more. And then so by the lifetime of those countermeasure that are already being implemented, a total of 3.2 million would be saved by the lifetime. And then here are some quick notes, and then you can learn more about the technical detail in the paper, but here are just some quick note to clarify some of the things. So for example, the tables are for each country, for each project, and then the project may not all happen at the same time. They have some sequential events, and also some of the project may have not started to have impact yet. That's why I see you will see an even further larger impact going forward. Next one. So here's our recommendation based on the finding, based on the understanding the result. Clearly indicate the great potential to prevent more deaths and serious injuries through more extensive use of the protocol, particularly in low and middle income countries. You remember from the map, IRAP already have a global coverage, but many part of that global map is missing. Particularly, for example, you can see in African countries where we know, right, those low and middle income countries account for majority of the road traffic deaths and injuries. So you can see if we are the global community can apply those protocol to more broadly to Africa and many other countries, we will see more lives saved. And then we also recommend improving safety conscious planning, design, construction, and renovation. And based on like I just mentioned, our current estimates need some assumption, but in the future we recommend more comprehensive data collection and more technological support in the work. So I think that is our presentation for now. So James is also on the call. Do have anything to add?
Yes, I'd like to say a really big thank you to both Abdul and Qingfeng for the pioneering research that you've done here. I think it's a really important first step in estimating the impact of IRAP partners around the world making on addressing the burden of road safety injuries. Of course, this is only the first chapter of the story, as the research is based on a sample of 440,000 kilometers of data across 74 countries that spans a period of 2016 up to 2020. But when you put it into the wider context of even just the star rating, which has been used across 1.8 million kilometers, and 126 countries. There's so much more that we could be shining a light on and celebrating, and so much good work going on. And so it's with this in mind that I'd put my request out to all IRAP partners, just to remember that at the heart of this research, that it's based on before and after studies. And so I really want to encourage you all to actually, wherever it is possible, to carry out those before and after studies and let IRAP know about them. Because it's firstly, it's important to highlight and celebrate the success that people are having in addressing this massive issue we all face together. But of course, it's with these insights we'll be able to actually further refine the methodology within this research and actually help us understand the impact and how it's varying around the world, and extend this methodology much, much further. Thank you very much.
Thank you all so much for your leadership in this study, which plays a truly essential role in enabling IRAP and its partners to positively influence investments and continue to save lives on roads. So let's now take a closer look at just how these numbers have influenced action around the world. Over 30,000 IRAP partners around the world are working together to ensure a world free of high-risk roads. The impact that we share today is the result of collective effort, but we also wanted to share a selection of case studies that exemplify the life-saving outcomes that can be achieved when 3-star or better safety is embedded in road infrastructure projects and policy. So I'd like to welcome Deepan Bose, the Senior Transport Specialist of the World Bank. The World Bank and the Global Road Safety Facility have been there from the start, shaping IRAP tools. And Deepan is going to share with us the life-saving case studies from India, Albania, Tanzania, and Colombia. Deepan.
Thank you, Natalie, and a big thanks to IRAP and all the partners for inviting me. So I'm Deepan Bose with the World Bank, and today I'm going to talk through a bit of the story on this immense potential that we have, celebrating today from the IRAP work where the World Bank has been involved. Can we go to the next slide? So like Natalie was mentioning that the World Bank through the Global Road Safety Facility has been engaged with the IRAP from a very long time. I mean, since 2006, the GRSF has been providing technical support and even involved in the development of the tool itself. So we take this very seriously. I mean, for GRSF, we have directly supported IRAP with more than 8.5 million, funds to, scale up the use of this assessment technology in our client countries, which are the low and middle income countries. And even outside of direct engagement with IRAP, we have supported the assessments totaling around 75,000 kilometers, which are worth $13 million US dollars. So just to give the immense scale of work that we as MDBs try to promote in spreading the use of IRAP for infrastructure safety. So between the period 2010 to 2019, World Bank financed rehabilitation of 10,000 kilometers of road, which were informed by IRAP assessment. Again, the key word here is these 10,000 kilometers have been rehabilitated. So this is, really showing the on-ground impact that the IRAP assessments can have in terms of saving lives. And needless to mention that the MDBs, collectively, our objective is to scale up these investments in safe road infrastructure and harmonize the approaches so that, we can collectively share how much life-saving potential this work can have. Now, a bit of, where we see, the value addition and why we value this partnership with IRAP, so much as a financier of infrastructure investments. So for one, which is obvious by now, that compared to any other methods, this particular protocol has the ability to deliver at scale. So when we're talking about large networks, this is truly a unique approach that can, tackle, at networks at very large lengths. Secondly, from our perspective, it helps as a tool, as a methodology for our client countries to understand how to prioritize the network, because of course budget is a constraint, but how to maximize the number of life saved and injury prevented within a set constrained budget using this particular protocol. Now, in terms of case studies, which Natalia mentioned, I'm not going to go through all the different case studies, but there are several of them where at corridor level interventions, when IRAP recommendations on engineering were combined with other multi-sectoral interventions, enforcement, trauma care, etc., they have a huge potential. So in one case example, like a state highway in Karnataka, a 70-kilometer stretch of road, compared to the baseline, there was 50% reduction in the number of deaths. So you can see the potential that it aligns with our vision of at least getting 50% reduction through our interventions. And again, going forward, I think the main challenge that all the MDBs we are trying to promote is how we can mainstream these IRAP results, these recommendations from network assessments as part of the planning process in road rehabilitation or maintenance or new construction. And that is the key. I mean, we are celebrating today the great potential this initiative has. And it's very important that the roads finally do get constructed with the recommendations, life-saving recommendations coming from this great tool. And finally, we also have examples where IRAP working with client countries like China, for example, the China RAP program, country-owned tailored program, has shown the direction where we can think about at-scale network improvement. I'm talking about like 100,000, 200,000 kilometer length network, which can be addressed through a partnership program. I'll end there. Thank you very much.
Thank you so much, Tipan. Wonderful to see you. And thank you again to the World Bank for your leadership. Now, as we're featuring MDBs, the Inter-American Development Bank has been working with IRAP for over a decade, investing in safer road infrastructure in Latin America and the Caribbean. Please welcome Esteban Diaz-Ru, Operations Senior Advisor of the Transport Division at the IDB, who will share the bank's life-saving success on the Pacific Corridor. Esteban, the floor is yours. Thank you for joining us.
Hey, thank you so much. It goes without saying that it's an honor and pleasure to be here celebrating IRAP. Also on a personal level, it's great to see so many colleagues that I haven't seen for a while, and to see that they still have the same enthusiasm and passion for saving lives. IRAP for us has been an incredible partner. We started working with IRAP in 2010. The first project that we did was the one I'm going to speak very briefly about now, the Pacific Corridor. But beyond that, we've also not only done the Pacific Corridor, but we've financed more than 25,000 kilometers of road assessments all over Latin America. We've worked in the Caribbean and most of the countries in South America, Brazil, Colombia, Dominican Republic, Ecuador, El Salvador, and Uruguay. And we've been very successful not only in doing these road assessments, but also in changing the culture of road agencies and how they look at road safety. Within the bank, we've worked in trying to make sure that we incorporate road safety indicators in all our road projects. Specifically for IRAP, we're trying to put them in what we call our evaluation matrix, and that would make them standard procedure for all our road projects. And we've actually done that in the first 2 or 3 projects. We've also supported our partners in the private sector of the bank in trying to incorporate IRAP in the support that they give for road concessions. And they actually are including IRAP metrics as key performance indicators for a lot of the concession programs that they're working on, especially in Brazil. Our artificial intelligence unit has also worked on something that they call Via Segura, which is trying to develop and use artificial intelligence to assist a little bit in IRAP coding. Please, next slide. Specifically, the Pacific Corridor. This was the first project that we did with IRAP. It's actually a challenging project. The Pacific Corridor is 3,600 miles. It's the main highway that connects all of Central America. It goes all the way from Mexico down to Panama. And it had a severe road safety issue. and the infrastructure was in bad shape. And we thought that it was a great example to try to test and be the first project financed by the bank in which we did the IRAP assessment program. The truck was there. I remember that when the truck was evaluating big chunks of this corridor, people were surprised to see I think it was a yellow truck. It was actually quite exciting to see the truck going down the corridor and seeing the results. Next slide, please. As I said, the corridor is around 3,200 kilometers long. I think that we did 2,600 kilometers of assessments. We were able to increase the percentage of three-star road dramatically. I mean, basically what the assessment did was it gave us a map on the investments that were needed. This is an ongoing project, so we still are investing in the corridor. This is not finished. But we've already seen some dramatic results. We think that once most of the investments that we have planned through the IRAP assessment program are done, we estimate that in 20 years, we're going to save 30,000 lives and around $1.5 billion. So you can see that the results of this are impressive. And to close, I think that really the impact that we've seen with IRAP goes beyond just the specific projects. I think probably the most important thing is that IRAP is now, I would say, standard language when we talk to road agencies. They all know what it's about. And it's changed the way that they look at roads, and it's really changed the culture. And the spillover effects that IRAP has beyond just the programs that are evaluated by IRAP, I think has been incredible. Thank you very much.
Thank you so much, Esteban. Those were really wonderful comments. And, you mentioned the enthusiasm and the passion for saving lives in this community. And honestly, that's one thing that makes this community not only so special, but also really effective. So thank you for your dedication as well. Now, the Asian Development Bank has also been a key partner, and here to share an impressive case study of success in China is Dave Shelton, the Senior Transport Specialist of Road Safety for the ADB. Dave.
Thank you, Natalie. It's a great honor for ADB to be joining this webinar today. We've got so many things that we'd love to say about IRAP, but I really wanted to start by recognizing what we see as a key enabler that's often underappreciated when we look at the achievements we're celebrating today, and that is the courage and the determination of the decision makers within our client governments who have supported investment in infrastructure, supported spending that limited resource that we have, money. They're taking out loans to invest in road safety. We find so many governments who are not prepared to step up to the plate and do that. But the only reason we have the results here today is because of the leadership of those governments who have seen the issues and been determined enough to secure the funding, whether through their own government's budgets or through loans, to make it happen. So IRAP is exceptional in guiding how we make those investments and targeting them well. But what we need is more of these courageous leaders to take us through to 2030. I would echo the comments about IRAP changing the thinking within our developing member countries and certainly changing the thinking within the bank itself. At ADB, IRAP is increasingly becoming the standard expectation for performance measurement in our road improvements. I'm going to talk about one particular project here, a very impressive project delivered in Shaanxi province in Western China. One of the great things about working in countries like China is that the populations, even in one province, are so large that the savings in lives and injuries that we can make with one project are extraordinary. 44 million people in Shaanxi province. This Shaanxi Mountain Road Safety Demonstration Project was the first application of IRAP by ADB using star rating assessments to set the quantitative infrastructure safety targets and indicators for a large loan. Prior to this, Shaanxi province had death and injury rates which were several times higher than the average across the provinces of China. Which we know is really struggling with road safety, so that is not a good record. What did we do there? Well, there were three major components, major upgrades to trunk roads. Importantly, the second component was a large, over 500 kilometres of road crash reduction improvements. So if you like, black spot investment on a substantial amount of rural roads. And then thirdly was to increase the capacity within their provincial transport department, strengthening its road safety capacity overall. You can see the results in this slide. 33% reduction in deaths, 53% reduction in injuries. You know, we're getting used to this from IRAP. This is what we expect from IRAP, and I think that's a great thing. We can actually guarantee our governments who are making investments that they will get the results if they can stick to the tools and implement them well. So I wanted to call out a couple of the important innovations from this particular project that worth noting here. Firstly, this project really positions road safety as the primary focus of a large-scale infrastructure investment, and making it the first time that we've done that. We could not have done that without the IRAP tools. We use the IRAP methodology very explicitly to demonstrate the costs and benefits. We're a bank after all, so we make decisions based on benefits and costs. And if you cannot quantify something in the manner that IRAP does, then you will not be successful in securing those dollars. It implemented an innovative approach also to bringing together safety education and awareness. In fact, police and the education were initially a poor part of this project, but the police in Jiangxi province, seeing what was happening, came along and said they wanted to be part of it. They got involved at their own cost and really resulted in some exceptional integrating work between police and the road authority, which is one of the most difficult things we find to do anywhere. And of course, the project demonstrated as a result the value of combining those infrastructure improvements with the behaviour change interventions. So this project, most importantly, really is a celebration of bringing together infrastructure improvements with other elements of the safe system approach to show what can be done and benefit a huge number of people in China. Thanks very much, Natalie.
Thank you so much, Dave. And, you know, you started by saying that what we need is more courageous leaders like the ones you highlighted to achieve the SDGs. But what those leaders need, of course, is effective partners like yourself and like all the other MDBs that we are highlighting. So I just want to thank you so much for your work. And now we'll turn to country-specific examples, starting with the UK. The UK has a very impressive record of evidence-based investment informed by the IRAP methodology. Here to share that life-saving impact is Kate Fuller, Road Safety Engineering Director of the Road Safety Foundation, which leads the UK Road Assessment Programme. Kate, thank you so much for joining us.
Thank you so much for inviting me. So the Department for Transport Safer Roads Initiative was first established in 2017-2018. Franco, could you change the slide, please? Thank you. All three sets of routes have been identified using the Road Safety Foundation's annual crash risk mapping project that analyses the safety performance of all motorways and A roads in Great Britain. Using this data, the Department for Transport was able to build a business case for investment. The primary aim was to reduce fatal and serious injuries on these high-risk roads, but as the approach was so new to the vast majority of them, there was also an opportunity to build capacity. So the secondary aim was to leave the road authorities equipped with the skills and tools to deliver proactive route-based approaches to risk reduction that align to the safe system. So far, there's been £200 million of investment on around 90 local authority A-class roads in England, with the first half of these shown on the map on the slide. IRAP surveys were used as a basis to identify issues with the roads, and the impact of the proposed treatments was assessed using the IRAP model. The impact on modelled fatal and serious injuries fed into the economic appraisal used to consider the proposals. Can I have the next slide, please? Thank you. The modelled expected results from Safer Roads Fund 1, 2 and 3 are very impressive, with the £200 million investment, with additional life operating and maintenance costs of a further £25 million, preventing an estimated 2,600 fatal and serious injuries over the next 20 years, with a value of prevention of injuries of £1.2 billion. When you compare the whole life cost of those measures against the value of prevention, you generate a portfolio BCR, benefit cost ratio, of 5.3, meaning that society benefits by £5.30 for every £1 invested. This demonstrates that road safety investments can really hold their own when compared with other major transport projects. And this is the first time we've been able to present something on this level of scale on local roads. So it was a really important exercise in showing what was possible. And we're now starting to see the impact of the first wave of investments coming through in the collision data, albeit it is noisy, not least because of the impact of COVID travel restrictions. It's very early days and we need several years more data really. But you can see where we are starting to see an impact, with the black line depicting treated routes showing a downward trend compared with the non-treated but could have been selected routes in green. This line is on a different scale to the smaller set of completed schemes in black to make the comparison easier. We hope analysis of 2023 crash data will solidify this very early finding. I'd just like to thank everybody again for listening and for inviting us to speak today. Many thanks, Natalie.
Thank you so much, Kate, and thank you for your work. Now, to Australia, where IRAP has contributed to significant improvements in public health, please welcome Antoinetta Cavallo, the Director of Planning, Research, and Insights and Technology in Road Safety for the Transport Accident Commission, which is an incredibly impressive entity. So I'm very excited to have you here today. Thank you.
Thank you, Natalie, and thank you all for inviting us to share our road safety story with you around the world. We're in the southern corner of the world, southern Victoria, Australia, southern hemisphere, and we've been investing in what we believe is a sustainable way to move to elimination of deaths and serious injuries. We have been, thank you, Franco, we have taken our highest speed rural roads and looked at those that carry a lot of traffic and essentially made a case to invest over $500 million into a top 20 program of close to 2,000 kilometres of road. We've wanted to comprehensively and sustainably make those roads safe, where it would be extremely rare for a serious injury or fatality to occur. Through that investment, we've been able to treat our major highways, both divided and some undivided roads, with median barrier, which is critical given 60% of our deaths involve moving across the centre median of those roads, and side barriers as well, using a safe system approach and an improvement in OSRA ratings. Our results so far are really, I guess, really heartening and very, I guess, really giving us that that motivation to keep going with sustainable road safety infrastructure investment. So far on those roads, we've dropped fatalities by close to 80%. We have actually close to 75% fewer days spent in hospital for those who remain in our crash data on those roads. So essentially, we only have 25% of that compared to the pre-period involved in these injury and fatality crashes and occupying bed days, which is a phenomenal effect when you're looking at true reduction in trauma and disability to those who are involved in crashes. And of course, this is all evidenced through the amazing increase of our star ratings in total from 2.9 on average to a 4.5 star across those corridors that have been comprehensively treated out of a total of 5, as you would know, given the way that IRAP works. So I guess using our TAC, Transport Accident Commission injury and claims data, we're hoping to continue this work, looking at more years of after data, and potentially looking at disability measures and hoping to see the same reduction in the amount of disability that that has been saved, I guess, as we have amongst hospital beds, fatalities and serious injuries. Thank you.
That's congratulations on those impressive results. I know they're going to have ripple effects around the world, and I really commend you for your efforts. Thank you so much for sharing that with us today. Now, finally, the success of IRAP's 10-step approach is very well known, but please welcome Susana Zamataro, sorry, Susana, Director General of the International Road Federation. IRF importantly represents industry and road agencies in countries. Susana will be sharing the success of the 10-step approach in building long-lasting, impactful partnerships. It's wonderful to see you. Thank you so much for joining us today.
Thank you, Natalie. Thanks to you, and good afternoon, everyone. It's holiday actually in Geneva, but I'm extremely pleased to and happy to take a couple of hours away from family time to talk about successful partnerships and how successful partnerships can help deliver significant road safety outcomes. And I want to do so exactly as you mentioned by talking about the experience we had with the 10-step project in Tanzania. It was the very first country applying this framework that provides country literally with a step-by-step approach to build national capacity for safer road infrastructure and helps them achieve the UN voluntary targets 3 and 4 that you have been hearing throughout this event. This was a 36 months project that has really helped embed change in how thousands of new and existing kilometers of Tanzania's roads will be designed, upgraded, and overall managed. And actually, we had some excellent news coming in just yesterday from Dar es Salaam and from Dodoma, where there's been a clear formal commitment that roads and streets will be built or upgraded to meet 3-star or better standards. So why is this pilot project important? It's important because, as many mentioned before, it really showcased how partnerships and evidence-based framework can deliver rapid life-saving improvements in road safety capacity and also performance. The project was delivered by, I would say, a coalition of the willing, literally IRF, IRAP, PIARC, UNECA, the Tanzania Road Association, and we engaged with literally anyone that had to do anything with safety in the country. And this was possible thanks to the support of the United Nations Road Safety Fund and also the Global Road Safety Facility of the World Bank. And so we came together and we brought our expertise together to build a lasting institutional capacity and regulatory framework to support safer road infrastructure. And not only that, I would say, the component of the project, which was in fact funded by the GRSF, included a specific focus on evaluating the impact of the 10-step project on capacity and transport development corridor projects. And as you can see, some of the incredible results that were achieved through the slides that you have on the screen. More than 10,000 kilometers of roads and designs have now been assessed using the IRAP methodology in Tanzania. We also did extensive training and capacity building activities, and more than 130 people turn out passing the final test, formal training courses, and as a result, we left behind with the project 30 certified road safety auditors and 22 people gaining IRAP accreditation in Tanzania, making Tanzania actually ranking second globally behind Brazil and just ahead of India. And the key milestone of the project was, in fact, the establishment of a specific Tanzania road assessment program, which will help ensuring systematic assessment of new and existing infrastructure and provide, of course, that objective measure of the level of safety built in the road. And these are just some of the achievements of the project. If we move to the next slide, what is really important is that the project has created, well, a lot of inspirations in other parts of the world. There's a new 10-step project currently being implemented in Senegal. We're also working always in partnership to reform and look and update the road design standard in Central Asia, always in partnership with IRAP, with EAST, and thanks to funding from the Road Safety Fund. And the same we're doing in Morocco, Mauritania. And I want to mention something that also Esteban mentioned before, the importance of the role of the private sector here. There's a tremendous untapped potential still when it comes to operators and concessionaires, exactly for the reason that Esteban was presenting in his presentation. I want to conclude by saying to you in the next slide, well, extending to you all an invitation to join us at the IRF World Congress in Istanbul this year, 15 to 18 of October, because you will have the opportunity to listen to many of these wonderful stories. And we are closely working with IRAP to pull together some interesting sessions where you can learn, and we will be exchanging on these incredible results. So in conclusions, congratulations to IRAP, of course, for making us able to drive change and delivering significant road safety outcomes. And to all of you just listening there, know that you're not alone. The tools are there, and we're all here to help you. Thank you.
Thank you so much for joining us on your holiday. I'm not at all surprised because I know how dedicated you are to this cause, but I am very appreciative. So thank you again. Thank you to all of our speakers for joining us from all around the world, and of course for your life-saving leadership. We could spend hours sharing other inspirational case studies of similar successes in many more countries, but we want to be very respectful of your time. So I encourage you to visit IRAP's website for more. And now I'd like to introduce one of my favorite people in this field, Rob McInerney, who serves as IRAP's CEO. Many of you know Rob, and I know that today's announcement holds a very special place in his heart. It's a testament to his lifetime of work, and I'd like to take a moment just to thank Rob for being the tireless driving force behind this global movement. Please join me in welcoming Rob.
Thank you so much, Natalie. And you're right, it's tireless. We're here at midnight in Australia, and it's a pleasure to be with you all. But today is a very, very special day. As you're right, it really is from the heart today that we have a saying within IRAP that we have not saved a life until the road is upgraded. And today we're celebrating all those 3-star or better upgrades from our partners all around the world. And we're so proud and thankful for each and every life that our partners are saving. We don't know who we've saved, but we do know it's someone you or I love. And so we've really been gifted a very special and unique role as a charity. And we're very grateful to our major donor, the FIA Foundation, and our other current donors, 3M, Prudence Foundation, and Aliatica Foundation, for that gift. It allows us to have an absolute pure focus on our vision to create a world free of high-risk roads. It allows us to have a pure focus on doing whatever it takes to save a life. And it allows us to mobilise the partnerships needed for 2030 impact, like all of the great partners that you've heard from today. And together, we are saving many deaths and serious injuries. As Abdul said, 160,000 new deaths and injuries saved this year alone. That's 438 people today. It'll be another 438 people tomorrow. As John said, we're also very thankful for all of our partners who've helped along the way, and the special role that the World Bank Global Road Safety Facility played in developing and piloting the tools. And now, all of our 30,000 plus government, development bank, industry and NGO partners who make use of the free IRAP tools all around the world. At its core, though, IRAP is just a small charity, but with a really big life-saving impact. Our board is made up of volunteers who have given their time and wisdom generously over the last 18 years. Most importantly, though, it's our incredible 5-star IRAP team that actually do bring that tireless passion and spirit and energy to our work as a charity. They have shaped the models, built the software, trained our partners, delivered these capacity building projects that Susanna talked about, supported policy change from the UN down to local schools, empowered local leadership, and ensured that we are also very well governed. All of the IRAP team and all of our partners, past and present, can be very, very proud today and every day. 700,000 people in total saved from death and serious injuries on the world's roads by the end of this year from all of your work. What an incredible shared success. When my son was only 10, I was a bit sad leaving on one of my trips that day, and he gave me a really big hug and he said to me, "Dad, doctors save lives one at a time. IRAP is saving them by the thousands." And we now know that number, 700,000. So today we celebrate each and every life our partners around the world have helped save. Every person who goes home safely to their loved ones, not even knowing that a safer road saved their lives. So thank you and congratulations and well done to every one of you. Back to you, Natalie.
Thank you so much, Rob. And as you say, you know, on behalf of the 438 people today that we've saved and the 438 more that we'll save tomorrow, thank you. It's loved ones who are at the dinner table thanks to your work. It's children who we can hug after school and who really are, you know, at the core of what we do, who drive us to do what we do every single day. So thank you so much, Rob. I want to echo your gratitude to your tireless and your dedicated team who follow in your footsteps in making a world with 3-star or better roads a reality. So now I'd like to open the floor for question and answer. Again, in the chat, please feel free to designate who you'd like your question to go to. If we don't have time to get to all of your questions, I can promise you that IRAP will answer your questions and will publish the answers for you to see on their website. So feel free to check back. Now, I've seen 3 questions that I want to start with. We'll get to more if we have time. The first one is, will you be working on including accessibility for different types of disabilities, including cognitive accessibility and not only ramps or access features for people with a visual disability? That's a great question, right? If we can make our roads accessible to all, then we will capture everyone, right? So James, I think you would be particularly poised to answer that question. Can I feel that one to you?
Yeah, thank you very much, Natalie. So yeah, certainly looking at the accessibility of roads for disabled people with cognitive challenges is certainly on the IRAP roadmap, and something we want to be incorporating within the models, especially as we're seeing more and more utilization of the IRAP tools within urban areas. I think this is a really important area that we need to be focusing on going forward.
Thanks so much, James. I really appreciate that. Now, the next question is, what level of influence does IRAP have on the political landscape when it comes to transport-related matters? And Rob, I hate to put you on the spot because it's midnight, but somehow you look more awake than I do, and it's 10:15 for me. I'm going to, blame my lovely children. But can I give you that question, Rob?
Absolutely. Look, I think the political landscape is changing. As David shared from the ADB, it's now becoming routine that people are looking at the IRAP standard. Etienne talked about the UN target that has set that goal that all new roads have to be 3-star or better for all road users. So we now at that sort of very highest political level have the mandate to make sure that we no longer build brand new 1- and 2-star roads. And so that political influence has been growing year by year, and it's becoming easier for it to magnify its impact around the world. The one big opportunity that I see, though, is very rarely do people celebrate saving lives when it comes to improved road infrastructure. And so my big opportunity for the world to embrace is that we spend close to 1% of GDP on land transport infrastructure every year. How good would it be if we were ribbon cutting every one of those investments that met the 3-star or better global standard? What that would do would make politicians look great. It would make communities understand that some roads are safer than others. And it would build that community understanding that if we do build safer road infrastructure, we will save lots of lives. And that then will create political momentum. We know it makes sense financially. We know the evidence base is there. So then everything there is basically ready for the scaling of political action from Morocco right the way through to 2030, where we start to see the speeds reduced or infrastructure improved to hit that 3-star or better standard on a scale like never before. That's the opportunity ahead of us.
Thanks so much, Robin. And there is so much opportunity ahead of us thanks to your excellent work and the research that we're talking about today. Now, the next question is, with road safety action not occurring in isolation, how did you estimate the impact of infrastructure alone? This is a really good one. And Greg, I'd like to put you on the spot for that.
Yeah, thanks, Natalie. Yeah, and it is a good question. So the modeling is done based on the IRAP assessments, which themselves have focused on the infrastructure impact. So measuring the impact of things like sidewalks, street lighting, traffic calming to slow people down. So it's very much focused on the infrastructure element. But if you take a look on our website and you take a look at the section called Stories of Success, you'll see dozens of case studies where road projects have been implemented and we've been able to measure the before and after star ratings and the impact on deaths and serious injuries. Many of those are very focused on the infrastructure elements. Some of them, though, do have components that are non-infrastructure. So they've had capacity building, or they've got police enforcement in place, or some sort of vehicle safety component happening at the same time. In those cases, it is hard to separate out exactly the impact of the different interventions, but in many cases, there's some way to do some of that. But overall, I think a key point is that, one, we know that the infrastructure interventions that are being put in place are saving lives. There's very strong evidence about that. And number two, we do really encourage projects to bring together the different elements of the safe system. Ultimately, we're going to get a really sort of high performance vision zero outcome if we've got the 5-star road users, 5-star vehicles, and 5-star road environment all together. That's really, really what we want.
Thanks so much, Greg. That's a very helpful answer. Now, another good question about the Global Status Report on Road Safety published by the WHO at the end of last year. The status report showed promising reductions in deaths globally, which is consistent with this research, of course, that we're talking about today. But it also highlighted two key challenges. And I'm going to give this question to Susanna and also to Dave. The increase in trauma in Africa. And the second one is a rapidly growing urban population. That would be for Dave. So what role do safer roads have to play in these two issues? Susanna, would you like to go first?
Sure. Thank you, Natalie. Of course, roads play a crucial role. for the simple reason that a lot of the population in Africa, if I'm not mistaken, 80% of people are still walking in Africa. And unfortunately, the design standards have been applied as standards from the 70s and 80s, which have not been updated for a while. And these are standards that we're focusing mainly on motor vehicles. So fundamental to make sure that infrastructure reflects the needs of all the road users. And that's why we are working so much, as you saw in my second slide, in a number of countries, starting from Senegal, but also Morocco, Mauritania, but also in Central Asia, to review and update road design standards exactly for that reason. So there's tons of lives to be saved in that respect. You always have to think that an engineer, at the end of the day, for how many political commitments the minister has done, he would always build according to the design standard and to the manuals. And so we need to make sure that, yes, of course, there's political commitment at the highest level, resources are there, but they also that the manuals that end up then being implemented by engineers on the ground really reflect properly road safety requirements. Thank you.
Thanks so much, Susanna. That's really good advice to remember that an engineer will always build according to design standards and manuals. Dave, do you want to talk about the rapidly growing and increasing urban populations and that is a challenge, how you overcome it?
Yeah, I sure do. So I'm going to talk just about two components of this, but of course, there's no part of the world that has a greater number of citizens living in cities than does Asia. And many of those cities are growing very rapidly. And in fact, what we're finding is the motorization is growing even faster than the populations. So first point, vulnerable road users in many of these locations make up the majority of trauma. So death and injury of motorcyclists, pedestrians, and cyclists for many of these locations is the dominant problem they have, and that largely occurs in cities. So focusing on cities actually becomes a key area for us to improve. Thankfully, they're relatively contained locations, but that doesn't necessarily make it easy because there's not much space. The second point, however, with respect to that, is that many of our developing member countries have poorly developed road management practices and institutions and governance. What the tools of IRAP do is that they introduce very good quality practices for institutions. It helps us to improve stakeholder engagement, to improve evidence-based decision-making, to engage the economic perspective of decision-making, and of course, they get reliable results. So these are precisely the performance measures that we need to address this real complex of safety, of social, of economic and environmental challenges that are facing our cities. So by lifting road safety performance through capacity improvement, we're actually lifting a wider set of boats in that same stream. Thanks, Natalie.
Thanks so much, Dave. And you mentioned that motorization is growing even faster than populations, and I think that's the key reason, right, that we need to scale up this great work. Now, I'd like to turn the last question to Greg. For countries that want to use IRAP and do more to create safer roads, what steps can they take?
Yeah, great question. I think number one is start with setting a policy for your country, a vision for your country about the star ratings of the roads. So that 3-star or better for the majority of travel on your roads, and 3-star or better for all new roads. So all designs, at least getting a star rating and trying to achieve that 3-star or better. That really recognizes the profound impact that safer roads can have on economies, people's health, and society. Number two is build capacity among your road agencies, your universities and institutes, and the private sector to use the tools, to do the star ratings, and to design and build safer roads. Number three was get using the tools. They're freely available for everyone to pick up and use today. Start assessing your networks, identify the high-risk sections of road, and develop plans for investment about targeting what sort of safety interventions you'll put in different places. And then most importantly, start building. Go ahead and start implementing the interventions that we know are working all around the world. And once you've done that, go back and measure the impact and keep fine-tuning that process. So I'd encourage those 4 key steps. Natalie?
Thanks so much, Greg, and thank you to all those who answered the questions. Thanks for letting me put you on the spot. To all our attendees, if you have any remaining questions, please do not hesitate to reach out to IRAP. And I can tell you firsthand that they are a wonderful team dedicated to answering all of your questions. There is no dumb question. I can tell you that because I've asked a couple of what might be perceived as that, and they always have good answers. So if we didn't get to your question today, the team will answer it and they'll post it to their website again, and just check back in a few days and you'll see your answer there. Now, IRAP will certainly help us save many more lives in the future, but before we look ahead, I just want to look back for a moment to when IRAP was established. It was very clear that there was a greater need for transparency and evidence and accountability and collaboration. And now this research shows us that we have met this need with very impressive life-saving impact. All of us, all of you, have achieved this by working together. But of course, there is more to do. And we can do more with the help of IRAP's tools and resources, which again are available for free. Now, I'm sure that our discussion today sparked some ideas for how we can further our efforts. And before we close, I want to provide you with just 3 examples of success that we can build upon. The first is policy. There are now 77 more policies, strategies, and plans around the world that include IRAP, and we know that there's more to come. The second is capacity building. Over 70,000 people have taken part in training and knowledge building events, and there's a network of accredited partners across 43 countries. There are over 16,000 registered users of the IRAP online software, which is called VITA, aptly named. And maybe today inspired you to join this network if you haven't already. Finally, investment. It's estimated that globally, IRAP has been used in road infrastructure investments over $100 billion. Maybe today led to an idea for how IRAP can influence other investments. We're clearly on a very exciting journey, and there's more to come. Thanks to all of you. So thank you again for joining us today. And once again, to all of our IRAP partners, congratulations on this tremendous result. This is truly your achievement. We invite partners around the world to celebrate your contribution to this life-saving impact. If it's helpful to you, IRAP's website has a press release, social media toolkit, and there'll also be an e-alert released today for your use. If you'd like to follow the success of IRAP partners worldwide, you can subscribe to IRAP's newsletters and follow its social media channels. I want to thank you so much for sharing your time with us today, and most of all, for what you do. You are part of a global community that is having real impact on people's lives and saving lives around the world. Thank you on behalf of the 700,000 people who are alive today and 3.2 million people who are not suffering from serious injuries and living full lives because of you. So on behalf of IRAP, the Johns Hopkins International Injury Research Unit, and the FIA Foundation, I wish you a wonderful, safe day. Thank you.